Take a look outside your backyard. What do you hear? What do you see? Chances are you can hear the sweet melodies of birds brightening your day. One of these backyard serenaders is the common house finch. These small perching songbirds have large beaks with long flat heads. They have short wings with notched tails and can come in a variety of bright colors. The most common types of finches that you can spot in our state are the American goldfinch, the purple finch, and the house finch. Finches are more than just a welcome presence in our backyards. They're important for spreading seeds and help keep weeds in check. They eat the grains and seeds of many plants such as sunflowers, millets, milkweed, and thistle. However, life isn't all sunflowers and millets for finches. These birds are plagued by a disease called Mycoplasma conjunctivitis, better known as House Finch Eye Disease. This disease was originally thought to only infect domestic livestock birds such as turkeys and chickens. However, it's been found in finches in the Maryland, Virginia region back in 1994. It's believed that the disease may have been picked up by finches through interactions at poultry farms. This disease can also affect other songbirds as well. The main infection site of this disease is the tissue around the bird's eyes. Some symptoms of this disease are glassy or cloudy eyes. In most cases, infected birds also have red swollen eyes with a scabbed appearance. The eyes release a discharge that can build up, which makes it even harder to see. Infected birds will also have runny nostrils with mucus coming out. House Finch Eye Disease also leads to an upper respiratory tract infection that makes it harder to breathe and birds becoming lethargic. Infected birds will not want to fly and stay close to the ground. Infected birds will also be weakened, disorientated, and isolated from the rest of their flock.
It was not until the 1940s that the transmission of house finch conjunctivitis was fully observed in house finch species. For poultry and finches, typical transmission is accomplished directly through aerosol or respiratory droplets, as well as feces. Additionally, transmission can also occur between the mother and its offspring. An infected bird will have signs of disease in a single eye first, eventually spreading over to the next through cross-contamination. Irritation of the eyes will usually result in the bird rubbing the diseased area on a bird feeder, branches, and other material, which can transmit the illness to neighboring birds. This direct transmission can be achieved through fomites, or objects that hold contaminants that can subjugate other birds to infection if contact occurs. Moreover, migratory seasons can cause stress on every species of bird, making them more vulnerable to secondary infections or more prone to infections. Bird feeders, while helpful to sustain energy for the birds crossing territories during this migratory season, make perfect fomite surfaces to encourage the movement of this disease in between individuals.
House Finch Eye Disease has certainly affected a great number of house finches, poultry, and even pets across the eastern side of America. This has been a scary event for bird watchers to endure. Many of them wonder, what are some actions that I can take to prevent the spread of this disease? Well, the best and most effective way to stop the spread of house finch eye disease is to focus on any bird feeders in your backyard. Bird feeders are the main way that this disease is transmitted. As a central location for interaction, close proximity allows for the transfer of this disease to go from bird to bird. To stop the spread of this disease, it's recommended that you do 3 things. First, clean all your bird feeders to kill any bacteria that could be on them. To properly clean your bird feeders, you should break down your bird feeders and use a 10% bleach solution. To make a 10% bleach solution, mix together 1 part bleach to 9 parts of hot water. You can either use wipes or soak the bird feeders in the bleach solution. If you use wipes, dip the wipe in the bleach solution and then clean the bird feeder. Be sure to wear gloves when handling any dirty bird feeders. The second step is spreading seed over a wide area so birds do not crowd around each other. The last step is extremely important. Researchers have concluded that high-density feeding sites are especially dangerous because the disease can spread easily between birds. To prevent this, move your bird feeders to another area of your yard to ensure that there is maximum distance between each bird feeder. Mycoplasma conjunctivitis continues to be a highly infectious disease seen throughout the eastern side of the United States. However, with an increase in public knowledge and common disinfectant practices, we can create a positive impact on the house finch and poultry populations by decreasing the possibility of infection. By doing your part to stop the spread of house finch eye disease, you can keep hearing the sweet songs of finches playing in your backyard for years to come.